Hi everybody, I'm Kristen Carpenter, one of the owners of Mend, and I'm here today with our newest fellowship trained physical therapist. This is Maggie Gephardt. We're really excited to have Maggie a part of the team at Mend. So Maggie is an expert clinician with just about as many years of clinical experience as I have. So between the two of us, we're talking several decades. Like I said, Maggie's a fellowship trained PT. She also is an instructor and teaches dry needling to physical therapists all throughout the United States. So that's really exciting. So I'd love for you to get to know Maggie a little bit. So she's going to tell us a little bit about herself and her professional background. So go ahead.
Yeah, hi guys. So I'm originally from Atlanta. That's where I've spent the majority of my physical therapy career, but recently relocated to Boulder from the Reno area, but spent close to 15 years in Atlanta practicing in an out-of-network cash-based practice. I've only ever practiced in that type of practice, and I am a firm believer that that is how PT should be done and how we give the best care to our patients. But really started in a very golf-centric practice, working with golfers of all levels from weekenders to on tour. But the other thing we really specialize in is treating complex, kind of recurrent injuries. Why are you still hurting? No one else can explain it. So that's really become a big part of my practice, is explaining the why you still hurt or why it keeps happening. And then pivoted and worked in the performing arts world, treating professional dancers, ballet dancers. So I kind of have been all over the map, and while doing all of that, did a residency and fellowship in Atlanta in manual physical therapy, taught at the entry level and residency level in physical therapy curriculum, and then also started teaching dry needling, which I have done for the majority of my career and really can't imagine life without it. Have a 3-year-old and just enjoying getting to know the Boulder area.
Yeah, so Maggie's a rock star, and I'd say she fits right in with us at Mend in her complex problem-solving skills and really wanting to get to the root cause of whatever the pain or functional limitation is for our patient population. So Maggie, I know you love the complex patient. What are some other types of patients that you really enjoy treating?
So I really enjoy treating lower quarter injuries, in particular kind of focusing on lumbar, spine, hip, pelvis, and really looking at how you move and how that's impacting kind of that area of the body, because I think a lot of how we move and how we function in our daily life can kind of centralize in that area. I do enjoy treating complex kind of SI, hip, non-arthritic hip injuries, however they may come about, and really dialing it in as to the why this is happening to you. And then my other big passion is treating what I call the forgotten mom. And I don't necessarily mean a mom with children. I just mean a woman who has dedicated the majority of their days and life into helping others, working with others, raising a family, career-oriented, whatever it is. And now that may be slowing down and they're getting back to themselves, or realizing that they maybe have some things that they haven't focused on themselves with their bodies. And so along with that, because you've got hormonal changes that happen in middle age, as well as a lot of hypermobility syndromes that I think as women we don't pay attention to or give enough credence to, and how that really impacts our bodies. So I really enjoy treating kind of that subset of that population as well.
Yeah, that's great. And then, as I mentioned before, Maggie teaches dry needling throughout the country, so she's an expert in myofascial pain. So Maggie, just a quick blurb on what myofascial pain is, and then we'll have some more resources coming on myofascial pain and how to recognize it.
Yeah, so myofascial pain kind of is an umbrella term, but it would be an alteration in the muscular or fascial system of the body that can have wide range implications, from widespread pain and referred pain, but also to more motor things. We can see reduced range of motion, stiffness, tightness. Maybe you're stalling out in the healing process. Maybe you're having pain somewhere else from an injury that maybe had kind of disappeared, but now it's rearing its ugly head again. And so looking at the integrity of the myofascial system and how that could be impacting the problem is kind of, in essence, myofascial pain.
Great. Okay, so that's Maggie. Brief intro to her. If you're interested in scheduling an appointment with her, you can click the Schedule Now button that you see in your email. So thanks so much. Reach out if you have questions. Appreciate your time.
Thanks, guys.